Now I want to give a word to our colleague and friend from India, Gururaj, very important doctor and researcher. Please, you're very welcome.
Thank you very much, sir. Thank you very much, Dimitri, sir, and all the participants. Thank you for giving me an opportunity to present one of the most important observations, what we have seen in our clinical practice. The most important thing, I am a therapist here in southern part of India, and I do a lot of Vatha therapy, physical therapy to the patients. And I use BioWell as a principal equipment to see before and after changes after the therapy, what we do. And it is very, very conclusive and very important findings what we get. And we can also correct the therapy parameters. But during this course, we came across certain very important observations in a BioWell. Can I share my presentation here? So we were also looking into certain other parameters, especially in regarding with the health of an individual or wellness of an individual. That's when we came across what is called as Three Doshas, or the three very important physiological doshas in mankind. Now, the most important thing is, can this be related with the BioWell reading what we are taking? Now, that was a very fundamental question, and we started working on different patients. Now, before we proceed into the actual findings, let us find out the actual constituents of these doshas. These doshas are constituted by the 5 elements which created this universe, and all of us are from this Panchamahabhuta. And these 5 elements, of course, are connected with different meridians. And these meridians in turn control the organs and organ systems of the body. We also know that BioWell readings, what we are taking, is connected with the meridian points on the tip of the fingers. So there is some relationship which we are able to generate from the meridians and the 5 elements of nature. In Ayurveda, the 5 elements of nature is the basics for the psycho-emotional and the physiological state of an individual. So when you talk about Ayurveda, we have 3 doshas. They are called as Vatha, pitta, khapha. These are predominantly the physiological findings or physiological bearings on an individual. And let's understand that every cell, every tissue of an organism, constitutes of all these 3 doshas. Now, the beauty of this is these 3 doshas are not independent. They're all dependent on one another by, again, the Panch Mahabhuta, or the 5 elements in the universe. So you can see the Vatha dosha, which is also called as the kinetic energy, is predominantly formed by the air or space and the ether. Now, that's very important constituents what we are getting now. The pitta dosha, or the thermal energy, is from the fire element. And of course, some amount of water element is also included in that. But the khapha dosha, or the potential energy, is from earth and water element. Now they are placed like this: the khapha, pitta, and vata. It also denotes that our body can be divided into 3 different segments: 1/3 top, middle 1/3, and the bottom 1/3. So the bottom 1/3 is predominantly governed by the vata dosha. The middle 1/3 is governed by the pitta dosha, and the top 1/3 is governed by the kapha dosha. And we know now that which are the elements governing these doshas. So this is another analysis what we give. Sometimes pitta is also considered to be a combination of fire and a little amount of water, because we just saw that water is the predominant energy which is being produced by an organism. Metabolism never happens without the presence of water. So water plays a very important role. Now, this was the findings which usually we do in Ayurveda. And these findings are done with a different type of detection mechanism. If you can see here, a whole of the universe again is controlled by the sun, moon, and wind. And again, if you see, they are further controlling the doshas in the body. Means every organism, every individual is responding to sun, is responding to moon, is responding to the wind. That is very important. And these factors, these sun, moon, and wind create certain amount of factors in the body, like the heat factor, the cold factor, or the controlling factors. Let's understand that the pitta dosha, as I told you, is the mid 1/3 of the body, is most effective and dominant in maintaining the digestive system of our body. It's a digestion process, it's a metabolism which we talk about. The khapha dosha is more towards the body elements, and of course it's more related to the immune system of our body. And the nervous system, dryness, etc., is completely controlled by the Vatha dosha. So with these three doshas with us, again, you can see the Vatha, Pitta, and Kapha can be detected by certain procedures. But the question is, we are measuring the same parameters in bioval. Can we detect these particular parameters in bioval or not? So how do we go about with that? So again, we went into certain Ayurvedic texts, which gives us different organs which are dominant in having these three doshas. Every organ has all the three doshas, but certain organs, they are dominant in having one of the doshas in them. So if you see, we are having right from earth, water, fire, air, and ether, we have different senses, and different senses controlled by different organs of the body, or openings in the body, we can say. And they have their own predominance in maintenance of wellness and health of an individual. Hence, we have Vata, Pitta, Kapha, which are having their own properties. And this is one of the very important finding in Ayurveda, that just by looking at an individual, we can say which dosha is dominant in this particular individual. But scientifically, we have to prove it. We have to get the data. We have to get the statistics of it. So when we looked into that, we looked into different detection mechanisms. In what are the different detection process in which you can detect this Vata, Pitta, Kapha. So one of the most important and universally accepted procedure is the pulse diagnosis, or Nadi Pariksha. It's done by a very experienced Ayurvedic doctor with the 3 fingers of his. Now, we can claim that this can be subjective, because the sensations, what we are going to get of the pulse from these 3 fingers may vary from individual to individual. And when we are detecting, especially in Nadi Pariksha, which is very accurate pulse readings, we have a unique measurement of individual of health. It identifies the upcoming risks of any disease or in an individual. It gives us a good idea about the health status of an individual, especially the stress. The dosha imbalances, it identifies the dosha imbalances. And also in Ayurveda, we can diagnose certain diseases and problems in an individual based on these Nadi Pariksha. Hence, the Nadi Pariksha, which we do, is with the 3 fingers on our, usually predominantly it is done on the radial artery. Now, the most important thing what we have to understand here is the whole of the Nadi Pariksha is based on the blood circulation in the vessel. Now, how much blood is circulating, what is the constituent of the blood, how thick is the blood, and what is the pressure this blood is applying on the arteries, everything is taken into consideration while doing a Nadi Pariksha. And let's not forget that we are also measuring the tip of the finger. And the tip of the finger has the highest vascularity, as we know, and the ejection of electrons from the tip of the finger is dependent on the amount of blood flow in that area. So the physical and chemical parameters of the tip of the finger is governed by the blood and the sweat in that particular part. So blood plays a very important role in making the Nadi Pariksha. So that's why, including the Gati, we have the Sarpa Gati, the Manduka Gati, and the Hamsa Gati, which means how the blood is flowing in the radial artery determines the doshas. Hence, in Ayurveda, there is a very simple formula. That means there are defined organs in Ayurveda which are dominant in these particular doshas. They have all the 3 doshas, no doubt, but they are dominant in certain doshas. So if, for example, we take Vata dosha, we can clearly see Pakvashe katisakti shrotrasti sparshanendriyam sthanam vatasya tatrapi pakvadhanam visheshataha. It is a universal formula that these particular organs in the body are going to be dominant in Vata. Similarly, we have dominant sites in the body which are dominant, having dominance in pitta dosha. And similarly, we have for khapha dosha. This is a very basic formula which is used in Ayurveda. Now in BioWell, we are measuring the energy of all these organs and organ systems, especially area and intensity, and of course energy is calculated from that. And we have a definitive diagnostic table for us where we have every finger divided into sectors, and these sectors representing these organs and systems, which means already with measuring the 10 fingers, we are getting the readings or energies of these particular organs and organ systems which are dominant in certain doshas, whether it is Vata, Pitta or Kapha. Now let's take your attention towards the BioWell application. Now in the BioWell application, we have scanned all the 10 fingers, and then I am very thankful to Dimitri sir because he helped me out in calculating these sectors and enumerating and giving me the data of these sectors. Now we know Vata dosha is under which sector, Pitta dosha is which organs and systems, and Kapha dosha is which organs and systems. Again, to reiterate, I am not doing any diagnosis here. We are not concerned about the diagnosis. We are concerned about these doshas. So Dimitri sir has created formula. He has created a program, rather I can say, which is in a primitive state, but then which can calculate these changes, which can calculate, this is a JavaScript given by him, which can calculate these changes automatically with all the 10 fingers scanned by you. And when you run this program, you are going to get the dominance of Vata, Pitta, Kapha. You can see the readings there. In the bottom screen, you can see the readings. It's very clear values what we are getting for Vata, Pitta, Kapha. On further discussion with Dimitri sir, he gave the idea that deviation from norms is more meaningful than having the record itself. We should know whether the dominant organs which are dominant in Vata, are they deviating from Vata or they have normal values. So that is when he calculated the deviation of the Vata, Pitta and Kapha. Now, all of us across, we are measuring our BioWell, no doubt about it. We are taking the measurement of 10 fingers, but now we can also get the parameters of Vata, Pitta, Kapha depending based on the immediate formulae given by in Sanskrit, in Ayurveda. So different organs and systems. Now, this was not sufficient, okay, we got some values. Now, can this particular value be compared with any standard device which is also measuring the pulses, nadi? That's where we came. I'll bring back to the screen again. So hope it's visible if I'm not wrong. Okay. So we came across what is called as a very important device in India. It's called as Nadi Tarangini. This device is meant for scanning or measuring the Nadi Pariksha. So it does a Nadi Pariksha, it has artificial intelligence in it. So it gives a tremendous amount of data for us, especially in the pulse part of it. So it's like having an Ayurvedic doctor sitting and taking the measurements. So it's very simple. And this equipment was taken and we started correlating the BioWell data with the Nadi Pariksha, Nadi Tarangini data. Now, what was the finding, what we got? The most important thing, let me take up this case itself, which we are referring to in our BioWell. So we can see according to BioWell, the records what I've taken for this particular patient, you can see a deviation in Vata and deviation is Kapha is very high, up to 21.2 and 31.5%, which is a huge deviation. So we know that Vata and Kapha are deviating. from the norms, which means that yes, there is some amount of symptoms which this person is going to have concerned with Vatha and Kapha. That needs to be balanced. Now, when we did the same experiment, same patient at the same time, we calculated in the Nadi Tarangini software, the same person. If you can see on the graph, it's very clear, and Nadi Tarangini is very, very comprehensive reports what we get, especially in regarding to the Three Doshas. And you can see very clearly the Vatha is increased, the Khapha on the extreme right, the green bar, that is increased, and the pitta dosha is almost constant, which means what we measured in biowell correlated with the very standard equipment meant for Nadi Pariksha. Then we started doing this for multiple cases. See, it's not for one, it may be a coincidence. So we started doing this for multiple cases. And the most important finding what we got here, which we didn't know when we started this particular experiment, was the presence of stress levels. Even the Nadi Tarangini equipment also calculates the stress level. And that stress level coincided with the stress level values which we got in biowell, which means the stress level, the Nadi part, that is a Vatha, Pitta and Kapha, they are predominantly seen in all this. If I can show you the complete report, it's around several pages reports. So here I have it for you on the screen. So you can see the reports what you're going to get from Nadi Tarangini, and you get different pulse, you get the readings, everything, etc., in relation with Ayurveda. But finally, when it comes to the stress, part of it, you can see here, prone to stress, it says 60% for this particular patient, which means the possibility of you getting stressed is on medium level, right? So it's equipment which is meant for this and which showing. And what did we get in our biowell? When you took the readings in biowell, not only the Vatha, Pitta, Kapha, and when I went in for the stress analysis of this individual, and you can see it is at 5.37 and absolutely at medium. So it is very much, now we have done it for several patients across. I have a database of more than 50 to 75 patients with biowell, with Nadi Tarangini, and the symptoms correlation of this particular patients, which means that with this much of data and the correlation of the data what we are getting in biowell and the symptoms of the patients, it is very clear that we are able to measure the Three Dosha, the Vatha, Pitta, Kapha, through biowell as well at higher accuracy, which is equal to that of any other standardized equipment meant for the purpose. Now, one more, we started with this, with Vatha, Pitta, Kapha, and then we got the finding of stress level as well. Okay, the stress level is it's matching. So we know that it's psycho-emotional and physiological state, which gives us the stress level. But then we got one more finding, which was very, very interesting. And here, in this finding, we were able to get the records. We were able to get the records of energies of Vatha, Pitta, Kapha. Now, what did we do? We started doing the therapies, we started doing the treatments, and then we started measuring the same thing. And we have a track of patients here, wherein we have seen that the changes in the symptoms of a patient has correlated with the changes in the biowell readings and has changed in the correlation with the exact Vatha, Pitta, Kapha. So energies of dosha, sthanas. So not exactly, we cannot tell that I'm measuring the energy of this particular individual dosha. No, it is the dosha sthanas. The energies of dosha sthanas is predominantly and very accurately being given in biowell now. And definitely, like how we have our chakral system, the chakras, which are based on certain sectors of the fingers and the readings and the parameters what we have taken, exactly the Three Doshas are giving us tremendous results with comparison with the Nadi Tarangini part of it. So not only the 5 elements, the Three Doshas, especially the Vatha, Pitta, Khapha, is measurable in BioWell. And of course, I have shared the JavaScript to my students as well. And they have also done certain experiments with their patients. And the same findings and same readings have been observed even there, which means universally, not just at our center. So multiple centers, we were able to get the readings and records of this particular doshas. Now, what is the use and significance of this? The use of this is especially knowing the weaknesses of a meridian in the body is very important, no doubt about it. But if you know which dosha has deviated from norm, we can give 3 levels of deviations. We have primary deviation, secondary deviation, and tertiary deviation. So primary deviation is the one which has maximum deviation. So when we concluded with this, that findings are fine, findings are giving us good results, then obviously the one what we did was to start enumerating the records now. And in this, if you can see in the records, we are getting the primary deviation, which is Vatha, the secondary deviation, which is Khapha, and the tertiary deviation, which is Pitta, which means in my therapy, I have to concentrate first on the primary dosha, then on the secondary dosha, and on the tertiary dosha. And when correlated with the symptoms, see, whatever readings we are taking from any equipment, it has to be correlated with the symptoms of a patient. And in BioWells, you know that we can see the problems well in advance, even without the person or individual having a symptom in it. And if you can measure the doshas getting deviated well in advance, then definitely the symptoms in the body, symptoms of an organism can be brought down very early. And therapy will be very successful for us. And symptomatically, it has been proven. Equipment wise, we are still concluding with several other records we have. We are going on doing the records, and we are going on giving the correlations with Nadi Tarangini equipment. And very important is the results, what we are getting with the patients. And that is one of the most important aspect when we talk about the results part of it. So with this primary, secondary, and tertiary records, it is now possible to determine in BioWell, at least at the clinical levels, where do we stand at Vatha, Pitta, Khapha. So it is possible, and we have been doing this. And as I have told you, the records are available with us for more than 50 to 75 with the correlation of Nadi Tarangini. So it has been correlating, and the correlation percentage, if I can say statistically, is around 90%. So 90% of the patients, we have seen the correlations. And in 10% of the cases, we were not able to get the correlation exactly similar to what was seen in BioWell. The reason there was because of the time duration. When we have taken the BioWell reading and the duration when the Nadi Tarangini was taken, there was a duration gap of around 4 hours, because of which there were certain changes, which, see, even taking a food, if a patient takes a food, definitely the symptoms or the readings changes in the body. So this was the reason why we were not able to get the correlations in 10% of the cases, but in 90% of the cases, we were able to get the readings. So if I can bring your attention to another case here. So it's more on the practical basis. So we are just going ahead with practical part of it. So if you can see this case again, and I just calculate the Vatha, Pitta, Kapha for this particular case here. So I just run this. So you can see there again, Vatha is primary at 18.7%. So which means I had the primary deviation of Vatha. So when you get this particular record, immediately we took the Nadi Tarangini record only to find out if it is correlating with this reading or not. More than that, when we looked into the sectors of individual organs and organ systems in bio, individuals, organs and organ systems, and When we went into the musculoskeletal system, the sacrum and the coccyx area showed as the deviation in Vata. So it is not only a generalized Vata, Pitta, Kapha, individual organs and systems, Tridoshas can be measured in bioval. That is, which makes it more beneficial when compared to your Nadi Tarangini. Nadi Tarangini gives you the whole picture. But here we are getting individual organs and systems. The Pitta dosha, though it is digestive system seems to be very normal at 5.91, but then you can see certain amount of changes in the individual organs and systems. So individual organ systems, Vata, Pitta, Kapha can be measured and analyzed using the bioval equipment. Apart from that, when we correlated this record with our Nadi Tarangini, this is a record here on your screens. So you can see in Nadi Tarangini, of course, we'll get the pulse of all the three, Vata, Pitta, Kapha. But the finding, what we get of a single pulse beat, you can see the Vata has increased. The Vata has increased. We have the Kapha being increased there, whereas the Pitta has decreased. So the relation of primary dominance Vata is very clearly shown. And of course, Vata and Kapha. And according to that, we have the Gati. Gati means the flow of blood. And depending on the flow of blood, it's very clear that even our biograms changes. So as Dr. Gururaj has mentioned in his finding about different research papers in the IUMAP website, we know the heart HRV coinciding with biovals. We have seen the arterial hypertension, which can be coincided with the bioval records. And then the same readings we get given here with the pulse mechanisms. And of course, if you see the different factors of Gati, that is Sarpagati, Manduka, and Hamsagati, which are calculated by our Nadi Tarangini device, has a coincidence with the bioval as well, because it gives us the dominance, and you can see the dominant is Vata. Clear. And the same readings we have got through our bioval equipment when we did and when we calculated. If you can see, we have the primary dominance of Vata, which is clearly measurable in the software. So the measurements what we are taking of the 10 fingers are actually measuring even the Vata, Pitta, Kapha. And of course, it's only the matter of sectors and calculations which were to be done. And those calculations were put in a software, and we are now running this for getting the records. And of course, with this, our therapy has improved. Our diet recognition recommendations, what we give to the patients, and what needs to be changed in the patients, that changes, because Ayurveda is a very, very positive and very universally accepted therapy. And not only that, it is giving you the basics of our life. The 6 stages of illness, what we talk, is based on Ayurveda. And with the Ayurvedic principles, if you are able to take forward the sectors of the body, if you are able to take forward the biograms, the changes in the biograms, then definitely it is going to give us more results in getting the betterment of an individual, to improve the wellness of an individual, and of course, to bring back any type of problems what he might be facing. But one part which we have observed, it's just an observation, might be it's still in the primitive stage, so we need more and more tests to be done across the globe which can prove it. But then in our observation, what we have seen is these correlations, what we are getting is if the patient is having up to stage 5, you can say in 6 levels of illness, we have stage 5 symptomatic levels. Till that level, it is fine. But when he gets into the terminal stage, or when he's hospitalized, when he's having any medications, if he's taking the medications, then there are huge deviations which we are seeing from the bioval readings and the readings which we are getting in the Nadi Pariksha may be it is an effect of drug or medicines, what he might be consuming during those period. But of course, we are now also doing the study on post-COVID cases, wherein the same type of modular studies we are following, and we are getting a correlation between these three doshas. So in BioWell, now we were able to detect and we were able to use it for our clinical practice, for our observation, that yes, the measurements what we are taking in the fingers are definitely giving us the results with these three doshas, and these three doshas are predominant in diagnosis, especially when you consider the Ayurveda part of it. So now we are formulating and giving the BioWell records and reports to Ayurvedic doctors, so they can do much better diagnosis, and they can go ahead with a different type of detoxification therapies, etc. And BioWell reports are being very useful in doing that, because even it's not a widespread use of Nadi Tarangini. Nadi Tarangini is being used by few Ayurvedic doctors in India, but BioWell reports, though it is not only giving the tri-doshas, it's also giving certain other indications, very important indications of the wellness, and it's giving much better results. So in coming days, maybe with the help of Dimitri sir, we may be correlating and making a new program for in BioWell. So like how we have the chakras, how I can see the chakral alignment, there could be a tab on the top where we can also immediately be able to see the Vatha, pitta, and khapha, and their deviations, which can be very meaningful, especially for therapists who are using BioWell across the globe. And also it can bring in the interests of Ayurvedic doctors who are looking out for equipments which are non-invasive and which are more accurate in measurements part of it. So this is the finding and this observation which I had done, and I again thank Dimitri sir for making it possible, making it happen. And today we are happy that we are having a good amount of records with us, wherein of course we are having all the data required, for which we can share it with the company as well. And definitely we can publish your paper as sir has told, and we can go ahead with the upgradation in the software as well. I thank everyone for patiently listening to me and looking into the practical analysis, practical part of it. And I am concluding my session 10 minutes before the schedule. Thank you very much. Thank you all. Thank you very much.